Hello, my name is Dr. Victoria Chamorro and I'm a consultant psychiatrist at the Priory Hampton. Today I'm looking through TikTok at videos of addiction.
When I sat in a room with other people and looked at the characteristics and the traits that people pick up as the child of an alcoholic, somebody that's experienced a parent that's like that, I knew that that was me instantly. What I very quickly started to realise is that when I used to get passionate about the nature-nurture debate, when I used to passionately say, it can't be anything to do with nurture because my life was so amazing and so idyllic, what I was actually doing is not being passionate, I was being defensive. And I was being defensive because when people pushed me to look at it being something to do with nurture, it was pushing me to a place that I couldn't or perhaps wasn't willing to go to and look at. I wanted addiction to just be something that I was born with.
So this gentleman makes a really good point. I think there's a thought that there is a specific demographic, that is the addicts, and that's not true. Anyone can suffer with addiction, and it's an illness that covers a huge range of people. When we're thinking about the nature-nurture debate, I think both play a role. And ultimately, even though the odds can be stacked against somebody, there is still things that you can do to change. And that's quite scary in one way because there is a responsibility aspect, which this gentleman touches on, but also it's empowering because you can absolutely change.
Do I think addiction is hereditary? I'm sure those of you that have come from an addict family or an alcoholic family can agree that when you come from that sort of family dynamic, that you can't help but look and go, well, look at the line of people that have passed this down. Now, some people think it's a gene. Very interesting to me. Some people think, oh, it must be learned behaviour, because I watched my parent deal with life or deal with things that were difficult by drinking. Is it generational trauma? Because I would definitely say that there's issues that have sort of gone through my family lineage and through the family tree that have made it this far and that I plan to put a stop to.
I think there's a temptation to want to find the single thing that causes addiction. And ultimately, I also wish that was true because then we could tell whether you were going to have problems with addiction or not. And ultimately, there isn't just one thing. It's a kind of loading of lots of small changes in your genetics and also different ways of coping with different stressors. Absolutely, there's a genetic component. Absolutely, there's also a coping skill style that is passed down. So I think it's all of the above. But the positive of that is even though you have some vulnerabilities towards addiction, absolutely you can get through it. So there's no, my family were addicts, therefore I'm going to be an addict for the rest of my life. That's just not true.
That's fine, but what was it within me that had no ability to stop or to say no? Because there's something that's set off in me when I have a drink that goes more. No ability to stop or control that. No impulse control, if you will. A lot of chat about ADHD and neurodiversity on here and in the addiction community and about what that means for people. There seem to be a very large number of people with ADHD or that are neurodiverse that have dealt with that and society's lack of understanding for that through substance abuse.
I'm really glad that you mentioned neurodiversity, especially ADHD. I find with my patients about a third or a quarter of my patients probably also have a comorbid ADHD that may or may not be diagnosed. And often when I see them, it's an opportunity to go through that. Obviously, that's an element of impulse control, but also lower dopamine thresholds. And it's something that is really, really common with addiction.
Every action and follow-on action that you do every single day creates a neural pathway in your brain. I'll break it down. You're hot, you turn on the AC. You're hungry, you go eat. You can't read something, you go put on your glasses. Yes, for the sake of survival, your body does things inside of you to signal to your brain, hey, I'm cold, I'm hot, I'm hungry, got it. But what happens when you incorporate alcohol into your survival as well? You feel anxious, you get a drink. You feel overwhelmed, you feel sad, you feel lonely, you feel frustrated, you get a drink. Your body starts to then become codependent and develop pathways in your brain that tell you, in order for me to survive through this moment, I have to go drink.
Yeah, I agree with pretty much everything you've said. We know from imaging studies that idea that neural pathways are used and become thicker and darker is very rooted in science. And even though we do develop those pathways based on a coping mechanism, and what I like to think about is in those particular cases, alcohol is the solution to the problem rather than seen as the problem itself. And finding better and different coping strategies is definitely part of the treatment.
When I was growing up, my parents would take every opportunity they had to remind me that alcoholism and addiction runs in my family. Like, I have always been aware from a very young age that I am predisposed to addiction issues because of my family and that I would most likely have an addictive personality. So when I started drinking alcohol, it was very important to me that I have a healthy relationship with it and to closely monitor my relationship with it to ensure there wasn't any sort of dependency developing.
So I think that's a really healthy attitude towards alcohol. If you know that you have a vulnerability towards it, then setting yourself some rules or things that you know if you compromise will raise some red flags in your mind, allows it to be addressed before it becomes an issue. And so this seems to be quite a good approach.
So my number one rule is that I never drink when I'm upset. I never use it as a self-soothing mechanism for when I am angry or sad or anything like that. I learned this lesson the hard way in college when one night I was really upset and I drank too much and I blacked out and said really awful things to a bunch of people I really cared about.
That's really common. Alcohol makes us emotionally labile, so really up and down, and it also makes us impulsive. So we all get into trouble saying things that we shouldn't say to people. Not using it as a coping strategy for when you're very distressed means you develop others that are much more healthy, and that will hold you in good stead.
So for me, alcohol is for good time celebrations when we're feeling level-headed, when we're in a fine mood. And if I am feeling sad, I will find a different way to self-medicate, usually through like watching TV to distract myself or, having a good meal or going for a walk or something like that. Because I think it's very important that alcohol doesn't become the thing that I depend on to get over a bad mood.
The other thing to think about is alcohol is a depressant. So if you're feeling sad, it will make you sadder and also more impulsive. So if you're somebody that struggles with self-harming or suicidality, it's going to make those things worse and can be quite dangerous. So we think of it as a party drug. That's not really the case. It lowers inhibitions and drops your mood.
Do you have any advice on trying to help a parent out of the hole of drugs and alcohol? How do you know when someone is past the point of help? Your videos have been very helpful to see the other side. Danielle.
It's very difficult to play the role of the parent when you feel like you are the child and you feel like the roles are kind of reversed in that situation. But if that person doesn't want to get sober and they don't want to address the problems, then it's very hard to make someone do it. I do truly believe, and it is one thing that I am adamant on, and that is that you cannot get sober if you don't want to. If drugs and alcohol still provide something good for you, a release for you, a stability, a connection, and whatever for you, and they still provide a level of relief, then that's kind of where that's going to remain until it doesn't anymore.
So I think those comments are really insightful. I absolutely agree that you need to want to get help to be able to be helped. Really, professionals give you a bunch of tools that you are able to enact yourself. So I often talk to my patients about, if you're thinking about a broken foot, a surgeon can take you in, do the operation, and then you come out. Essentially, your foot is fixed. Psychiatry is totally different from that. And what we do is we just give you tools to be able to do that surgery on yourself. And of course, that's much harder and a lot less passive. You have to be actively part of the process to be able to do it.
It's also about protecting yourself. If your parent doesn't want to hear it and they doesn't want the help, you do sometimes have to listen to that and just accept that they're not ready and they may not ever be ready. So also protect your own happiness and your own peace and be loving from afar, because it can completely consume other people's lives trying to get people better that don't want to.
Just a comment about the comment that lady was responding to. I don't know how old that initial commenter was, but it seemed to be talking about a parent, which makes me quite concerned. There are lots of kids out there that are acting as parents to their parents, and it absolutely is not their job. It's very hard when you have a loved one who is down that self-destructive path and they're unable to care for you or themselves. There's also this idea that you might be collaborating with them, that you keep it a secret to protect the family. And nothing really can be further from the truth. The best thing to do is to shine a light, to get help. Addiction thrives in the shadows and the shame. And putting light on it, telling people, is the way that will, even if it causes a lot of disruption, distress, in the longer term, will absolutely be there to help you.
Alcoholism is not genetic. What is genetic is one's predisposition to addiction. That's what's genetic.
Unpack that. Third grade level.
Trauma is passed down through one's genes. The greater degree of trauma that you have, whether through your own direct experience or that which has been passed on to you by your parents, the more prone you are to addiction.
Yeah, but that passing down may be psychological. It may also be genetic. And it is lots of small variations in genes that causes a predisposition, or what I like to think of it is a reason you might find it difficult rather than a reason not to be sober. And that kind of loading can predispose you towards having it. But it is really not a kind of end of the road situation. It certainly isn't because my parents have had difficulties that I cannot stop being an addict. That's really not the story.
Reason number one why I choose to stay sober. For me, the thing that I value more and will go on to value for the rest of my life is what my kids think about me. For a long time, my two older kids saw a really shit version of me, a really weak person that was mainly down to drinking too much alcohol, so a really poor version of their dad. These days, they see the best version of their dad.
So the first thing I want to say is if you're struggling with addiction and alcoholism, you're not a weak person. Typically, I find that these people have gone through huge amounts of trauma and have horrendously hard lives. It's not a sign of weakness, but it is a sign that your coping strategies have been overwhelmed and there might be better things that we can do.
I'm 41 now, so let's say for argument's sake that I'm halfway through my life. How do I want to use these remaining 41 years? Is it to be Mr. Sociable, to be out in the pub all the time having a laugh and a joke and drinking myself silly, and then being a really shit version of myself and being a really shit dad? Or is it to be ready and available 24/7 when the kids need me and when my partner needs me? Let me know what you think. Is this something that you value if you're sober?
And having those positive reasons to be sober is absolutely part of your recovery journey. What I say is motivation is like a fuel. It starts running out. So if you can think of reasons and purposes and provide meaning in your life, it's a lot more sustainable than just kind of motivation. It tops it up, but also starts to build something called resolve, which is largely structure and meaning.
What is it?
It's a whiskey barrel.
I love it.
Is it triggering you?
Yeah, okay, that's quite cute. It does make me think that the loved one is wondering about triggers and is curious about triggers, but I suppose we don't get our whiskey typically from barrels anymore. More common triggers are the things that you associate more commonly with alcohol. So going down to the pub, going to certain areas, that sort of thing. Often I find that alcohol is often a trigger to take cocaine because often it's taken in that kind of party situation. So working out what your triggers are and then having a plan for when you address them is the way to go. I have seen some very interesting things done with virtual reality now where they expose you to your triggers in a very safe space, and then you can practice your coping skills to be able to cope with those difficult situations. So the field is evolving, and I think there's going to be some more thoughts on that soon.